specify that if the patient has pain in any one of the following, x-rays are indicated. First, if the patient says they have tenderness on the posterior edge of the lateral malleolus, as well as on the medial side, at the base of the fifth metatarsal here, tenderness along the navicular bone, which is medial to the cuboid bone here. In addition, if the patient is unable to bear weight for 4 steps, in addition to their pain, an x-ray is indicated. Test item cluster for those that will respond to spinal stabilization includes 4 different components. The first finding is whether or not the age of the patient is less than 40 years old. Second, you're going to assess for the presence of aberrant motion. Courtney, go ahead and bend forward and back up. Courtney didn't display aberrant motion, but you may see pseudo-Gower sign, instability catch, reverse lumbopelvic rhythm, and pain with motion. Did you have any pain? Next, perform the prone instability test. You'll have the patient lay against the table. Do you have any pain?
Right there.
This is your pain?
Mm-hmm.
Go ahead and raise your legs off. And does that recreate your pain?
The pain decreased.
Okay, and relax. A positive test is indicated if pain is only present when the legs are down. The next test is the straight leg raise test. Simply passively raise the leg when the patient lays supine and assess for pain as well as facial expression. The test item cluster for those that will respond to spinal manipulation includes 5 different criteria. The first finding is symptoms less than or equal to 16 days, and the second finding is no symptoms distal to the knee. The third finding is hip internal rotation greater than or equal to 35 degrees. And the last finding is hypomobile segment of the lumbar spine. And the last clinical finding is an FAB-Q score work subscale less than 19 points. Successfully test is a test for meniscal pathology. First, you'll have the patient supporting their upper body as needed, stand on the affected limb at just 5 degrees of knee flexion, and then ask the patient to rotate side to side, noting whether there's a change in their symptoms. Then you'll do the same thing at 20 degrees of flexion. And go ahead and rotate and relax. Anterior drawer test. Provocation test for lower limb tension. Perform as follows. Courtney, go ahead and slump as you're sitting here and bring your head towards your feet. And flexing your neck there. Go ahead and straighten your leg now. And then bring your toes towards your head. Good. And last, go ahead and extend that head up. The test item cluster for hip osteoarthritis includes age greater than 50, hip internal rotation less than 15 degrees, hip flexion less than 115 degrees, or age greater than 50, morning stiffness for duration of equal to or less than 60 minutes, and then internal rotation greater than 15 degrees, and pain with internal rotation. Knee valgus stress test at 30 degrees of flexion. Sign of the buttock. First, start with your straight leg raise. And once you get to their end range, you want to flex the knee and assess for hip motion. This is the differential diagnosis for gluteal or hamstring weakness versus an L5-S1 radiculopathy. First, I'll perform the straight leg raise test on Courtney. What I'm looking for here is reproduction of her lower extremity radicular symptoms at or below 30 degrees. Then I'll perform the well leg raise test. This is moving the contralateral leg to a similar degree and observing for or asking for symptoms reproduced on that affected side. A positive test is considered if symptoms are reproduced on the affected limb when moving the contralateral side. This may be indicative of a space-occupying lesion such as a central disc bulge. To further differentiate between these diagnoses, you can perform the following. A strength test in the L5-S1 myotomal distribution. Also assess for abnormal sensation in the L5-S1 dermatomal distribution, which L5 is right here on the lateral side of the leg, crossing over to the first two toes. S1 is the three toes going underneath the sole of the foot here and back up the leg. To determine if the patient has gluteal or hamstring weakness, simply perform a manual muscle test for each muscle. Typically, glute and hamstring weakness only presents as decreased strength and can be tested using the manual muscle test for each muscle. L5 or S1 radiculopathy will demonstrate abnormal sensation in the dermatomal distribution. They may experience decreased strength in the myotomal distribution and potentially a diminished reflex. Knee valgus stress test at 30 degrees. Sorry, go ahead.
Sorry. It was draining down, my stuff was draining down my throat. Like, come down. Is it on? Oh, there you go.